Okay, so the drug that I'm going to be doing my teaching on today is the generic name is going to be Risperdal and the brand name is Risperdal. So it's the drug class, it's an antipsychotic drug. So it treats schizophrenia, and schizophrenia is a mental illness that causes disturbed or unusual thinking and loss of interest of life. It can also treat bipolar disorder and irritability caused by autism. And it also treats mania episodes, which includes the client being frenzied, abnormally excited, or in an irritated mood. And it also treats mixed episodes, which is a mixed episode of mania and bipolar. Risperidone is also used to treat behavioral problems like aggression, self-injury, and sudden mood changes. It comes in different forms. It comes as a tablet or a liquid solution, or an orally disintegrated tablet, which is just a tablet that dissolves in the mouth quickly. It's usually taken once or twice daily, and you can take it with or without food. And you want to take it around the same time each day. The liquid solution shouldn't be mixed with cola or tea, but you can take it with like water, orange juice, coffee, or a low-fat milk. Risperdal, it treats the symptoms of the condition, but it does not cure the condition. So and it may take up to several weeks for you to feel the full effect of the medication, for you to get the full benefit of it. And even if your symptoms subside, you want to keep taking the medication. You don't want to stop taking it, and you don't want to stop suddenly, because the symptoms may return and they may be worse and they may become harder to treat. When you're prescribed this medicine, you want to tell your doctor if you're taking any other medication, and that includes prescription medications and non-prescription medications, anything over the counter. You want to tell the doctor if you're pregnant before starting this medication, because the drug has been known to cause problems in newborns if it's taken during like the last month of pregnancy. So if you're pregnant, you just want to avoid taking that medicine. The medicine, risperidone, it can make you drowsy. So when you first start taking it, you don't want to operate any machinery until you know the effect that it has on you, because it doesn't have the same effect on everyone. So you just want to make sure that you see how it reacts with you before you operate any machinery. When taking Risperdal, you may experience episodes of hyperglycemia, which is high blood sugar. So that may have to be controlled with insulin, and that even occurs in patients that do not have diabetes that's taking the medication. So you want to monitor your blood sugar while taking it. It may cause dizziness and lightheadedness and fainting. And if you rise too quickly from a lying position, you may get dizzy and faint. So you want to rise slowly. So when you're lying down, you want to get up slowly, and you want to rest your feet on the floor for several minutes before actually getting up, to avoid fainting or getting dizzy. You don't have to change your diet when you're taking this medication. You should continue your regular diet, so you don't have to make any dietary changes. And if you miss a dose of the medication, you just want to take that next dose when you remember. But if it's close to the time if it's close for the time of your next dose, you want to go ahead and skip that dose and just wait and take it at the regular scheduled time. And then you want to continue to take it as you were. You do not want to double up on the dose. So side effects of the medication include nausea, vomiting, and diarrhea, constipation, heartburn, dry mouth, increased salivation, increased appetite, and which can cause increasing your weight gain, stomach pain, anxiety, agitation, restlessness, difficulty falling asleep or staying asleep. And in women, it could cause late or missed menses or a period. It can also cause vision problems, muscle or joint pain, dry, discolored skin, difficulty urinating or initiating a stream of urine, dizziness, and feeling unsteady when you're walking. You want to call a doctor immediately if you experience these symptoms, and that's going to be fever, muscle stiffness, confusion, falling, unusual movement of the face of the body, seizures, rash, hives, itching, any shortness of breath or dyspnea, difficulty swallowing, and in men, if you have a painful erection that lasts for hours. And if you want to call the poison control line in case of an overdose, and the symptoms of an overdose can include drowsiness, a fast bounding or irregular heartbeat, upset stomach, seizures, or fainting. And you'll be provided a number to the poison control if you experience any of those symptoms. You just want to make sure that you call them as soon as possible.